Hello, my name's Carol Howley. I'm the ward manager of the Cardiac Intensive Care Unit. The video you're about to see has been produced by a group of nurses who all work within the unit. Our aim was to provide you with a visual representation of what to expect following your surgery. It'll also show you some of the equipment and the staff you will meet during your stay with us. We hope you find the video informative and interesting, and thank you for taking the time to watch it.
CITU is a 20-bedded intensive care unit that is for thoracics and cardiac patients. Visiting time is 2:30 p.m. till 8 p.m. On the day of theatre though, visiting time is at any time following the surgery. If you're unable to visit during these times, alternative arrangements can be made. We do request that there's only 2 visitors at the bedside at any one time, and the visiting is kept to a minimum of about an hour to an hour and a half. This allows a patient to rest in between activities of physiotherapy, doctor's round and nursing activities. We also ask that you avoid meal times for the patient's comfort. For your convenience, the visitors have 2 visiting rooms that have got televisions and books in, and also 2 toilets by the entrance. Visitors' entrance into CITU is by an intercom system. Please press the intercom intermittently until it's been answered.
Hello?
Hello, I'd like to visit my husband, Mr. A, please.
Okay, one moment, please. Yes, please come through. The door's open.
Thank you. For infection control purposes, on entering the unit and leaving, please gel your hands. The patient will be taken from the ward into the anaesthetic room, where they will meet the anaesthetist and the theatre team, who will be dressed in green. A Venflon will be inserted into the arm and the anaesthetic given. Following surgery, the patient will be taken into the CITU area by the theatre team and the anaesthetist escorting, and handed over to the intensive care nurse that will be looking after the patient on a one-to-one basis.
It is important to know that these painkiller methods are aimed at relieving the pain to get you comfortable so that you can participate in the physiotherapy exercises to help in the recovery. If you are still in pain after receiving these painkillers, you should let the staff nurse or the doctor looking after you know so that they can help you. It is not always possible to get rid of the pain completely. Please remember, we are here to help you and make your journey comfortable and safe.
The nursing staff on CITU includes our matron, ward manager, advanced nurse practitioners, sisters, charge nurses, staff nurses and healthcare assistants who will have daily input into your care. You will note the different coloured uniforms which show who we are. The multidisciplinary team on CITU involves many health professionals to help care for you the best we can. Let's have a look at who you will see during your stay with us. The cardiothoracic consultants who are conducting your surgery are ultimately responsible for your care. The registrars who work closely with them are specialist doctors working towards their consultancy posts and will have a big input into your stay during and after your surgery. You will meet consultants and anaesthetists who will assist in the planning of your care and rehabilitation on CITU. The anaesthetic registrars again work closely with them and are working towards their consultancy post. During your stay, you will also see cleaners, radiographers, physiotherapists, pharmacists, ward clerks and our housekeeper. If you have a prolonged stay with us, you may also be likely to meet more of the multidisciplinary team, including dietitians, speech and language therapists, tissue viability nurses and chaplaincy, to name a few. Our daily ward round is conducted in the morning and involves the consultant anaesthetist and registrar, advanced nurse practitioner and nurse in charge who will review all aspects of your progression with you and instruct the nurse looking after you and can explain why they can benefit your care. We recognise that you are at the centre of all the care we provide, and we see your family and friends as a big part of your rehabilitation during and after your admission to CITU.
This is the monitor where we will read your vital signs. You will have on ECG leads to monitor your heart rate and a finger probe to monitor your oxygen levels. You will also have an arterial line, which is a small cannula, usually in your wrist, that we use to monitor your blood pressure continuously. Your nurse will take a small blood sample every so often throughout the day and night from your arterial line. The nurse will check your oxygen levels and electrolytes and act on the results if required. You may notice that the monitor will alarm sometimes, and it will sound like this. Usually this is nothing to worry about. It is just letting your nurse know that something has changed outside of the parameters that they have set. After surgery, you will have chest drains. Your nurse will closely monitor these to see how much fluid is draining from your surgical site. These will be reviewed daily and removed when appropriate. If you have had cardiac surgery, you may have a temporary pacemaker. This is attached by wires in your chest and can be used if required to help restore a normal heart rate and rhythm. The pacing wires are usually removed after a few days if no longer required. You will also have a urinary catheter to measure and collect urine. The nurse will check the amount of urine each hour. You may have to wear support stockings for approximately 6 weeks after surgery. These are a preventative measure against deep vein thrombosis or blood clots.
This is the ventilator, and it is connected via this tubing to the endotracheal tube, otherwise known as the breathing tube. The ventilator, when you come out of theatre, will help you breathe because you are sedated and will be unable to breathe for yourself. Once the sedation is switched off and you begin to wake, the ventilator may alarm a lot and it will sound like this. Try not to worry when this happens. This is just informing the nurse that you are beginning to wake, and she may make some minor adjustments to the ventilator until you are fully awake. Once you are fully awake, the nurse will prepare you for extubation. She will talk you through what will happen next and then safely remove the breathing tube. After the breathing tube has been removed, she will then suction you just to remove any secretions that you may have in your mouth, and then place an oxygen mask over your face to give you some additional oxygen support. The medications are given to you by these syringe pumps here, which are then connected to these lines here, which in turn is connected to the central line here. And this is how you will receive your medication after surgery. On occasion, you may notice that these pumps will alarm, and the alarms will sound like this. Try not to worry when you hear the alarms, it's just alerting the nurse that we may need to change the syringe pumps out.
Your nurse will monitor you closely throughout your stay on CITU and record your observations, which include your blood pressure, your heart rate, your oxygen levels, any drain fluid, urine output and any medications that have been given. This information will all be documented on a large chart at the end of your bed. You will see all the members of the medical team during your time on CITU. The nurse will discuss your progress with them and highlight any issues that have arisen in relation to your operation and your recovery. This could happen a number of times throughout the day. As you recover, your nurse will start to remove lines and tubes you no longer need, ready for your step down to the ward. Initially, your nurse will be looking after just yourself, but as your condition improves, they may have a second patient to look after. This is to encourage you to gain some independence, ready for your transition down to the ward. The nurse will help you with your hygiene needs, encourage you to eat and drink, help you to mobilise, and promote you to do your deep breathing exercises set by the physiotherapist. After surgery, patients are often restricted to the bed or the chair and at risk of developing pressure sores from lying or sitting in the same position for a long period of time. To prevent this from happening, the nurse will reposition you in bed and ask you to stand up if you're sat in a chair. After surgery, it is common for patients to become disoriented and confused, and this can be due to a lack of sleep. You will be provided with an eye mask and some earplugs to wear throughout your stay. You can wear these during the night time to help you sleep, or during the daytime if you feel you need a rest. Your nurse will regularly orientate you to time and place and question you to ensure you know where you are. The nurses on CITU are there to provide support to you and your family after your operation by giving members of your family regular updates on your progress and answer any questions in order to help you recover.
After your first night on CITU, you may be assisted out of bed into the chair by the nurses. Diet and fluids will be offered as appropriate. If you feel any sickness, it is important to let your nurse know, as they can give you some medications to try and stop this. You will be seen by a physiotherapist who will go through deep breathing and coughing exercises, and you will have the use of a device called a Spiro or coach to help you practice breathing techniques throughout the day, which we encourage hourly. We will encourage you to stand and march on the spot, known as sumos, as able. To perform all of these exercises, it is important to maintain adequate pain control. Drains and lines will possibly be removed after discussion with the surgeons and anaesthetists, and you may be able to go to the ward. If you are on any medications via the infusion pumps, these may need to be weaned off by the nurse. If you require more oxygen, we may use a device delivering a higher flow called nasal cannula high flow. It is very likely you will feel tired throughout the course of the day, therefore it is important to rest in between physio, exercise, etc.
Postoperative confusion and delirium may manifest as a patient being quiet or withdrawn, or in a patient being agitated, aggressive, paranoid, where they may pose a risk to themselves. Typically, patients suffering from these conditions may have a difficulty in concentrating, they may be unable to understand what's going on around them, and they may also hallucinate, hearing and seeing things that are not there. We understand that seeing your relative in this way may be distressing. However, our staff are very familiar with these situations, and our nurses will regularly assess our patients for neurological changes. The nurses may need to administer medications to help to keep the patients calm and to help resolve their confusion. As family and friends, you can help by doing a few things. You can use simple words and phrases. You can bring in familiar objects for the patients, such as photographs. You can help to reorientate them to the surroundings by telling them the date and the time, and you can make sure that they have any hearing aids or glasses that they may require. These issues may resolve over a period of hours to days, but please feel free to ask the staff for extra support and advice during this time, and we may be able to provide you with additional information regarding these issues, such as our delirium brochures.
All the nurses you have seen in this video are part of the family support group on cardiac ICU. This support group was set up in January 2017 and consists of 8 experienced nurses. We formed this group because we understood how important it is to provide reassurance and support to the families of our patients. We will ensure communication between you, your family, the medical and allied health teams will be up to date, and we will support you through any issues you may have. Our team of highly trained nurses on the unit will be able to answer your questions on a daily basis. This, together with the family support nurses, helps to improve the overall experience of having a family member in hospital. We hope you have found this video helpful and informative, and thank you for taking time to watch it.